Thank you very much for this nice presentation. Good luck, this guys.
Yeah.
Yeah, I would really thank Dr. Mukdadi for inviting me today to talk about, I think, a very important topics. We all deal with every day. I elected to talk about, the internet resources, the most important internet resources I used to use when I was a pediatric resident, or when I was a child neurology fellow, and we will, go through, at least probably 14 or 15 websites, and I will scan through them quickly. I use this website most of the time. I think they are very helpful for us. So Dr. Mukdadi put the name, of course, he put the doctors.com, and I think, hopefully it will be very informative. Outlines. First, why do we need to look for resources on the internet? We'll answer this question. Second, how can I evaluate the good resource websites? And what are some of the good resources websites for physicians? And what are some of the good resources websites for patients? Now, why do I need to know a good healthcare resources website? There's a wide availability of internet and easiness of obtaining information from the internet. Internet is more of a private consultant to families and patients. So a lot of the patients, especially apply to the subspecialty, whether like pediatric or subspecialty, pediatric GI or pediatric child neurology. The family will come to you after they reviewed probably most of the internet resources that we don't know if they gave them the right information or the wrong information. For this reason, we need to help direct patient to best patient resources, and of course we live in a computerized world, and we need the best for our patients. Now, I need to go to the medical school. Back in the medical school, we did the oath of a physician. And a lot of the time, when we get very busy, when we see a lot of patients, when we are sleep deprived, we tend to forget why we decided to be a physician to start with. And I want to remind you with the oath. This is part of the oath. And when they say, therefore, make us worthy of this favored station, being a physician, with honor, dignity, and piety, see that we may devote our lives in serving mankind, poor or rich, literate or illiterate, Muslim or non-Muslim, black or white, with patience and tolerance, with virtue and reverence, with knowledge and vigilance, with thy love in our hearts and compassion for thy servant, thy most precious creation. So a lot of the time, I tend to forget that, and a lot of us tend to forget that in a very busy day. But I want to show you this, poem written by one of the seizure patient, and I want you just to imagine how much this patient has been suffering, and I want you to see his feelings every time he has a seizure. He might come to my office, I give him medication, and I might stop the seizure, and I don't think probably about it more than 10 or 15 minutes. But I want you guys to see how much we can make a difference in a patient's life. That is the job of a physician. Okay, so this is a poem written by Stuart Ross McCallum. This patient clearly stated what he is suffering from and how can we change the life of a patient. Go back to business now. How to evaluate a good resources. First, very important, you have to look who runs the web-based health resource site. Is it a branch of the government, a university, a private business, a private clinic? Who pays for the health website resources? Is it Dr. Mukdadi Clinic? Is it Abbott? Or is it SKMC? Or is it My Clinic? Purpose of the online health resource. You really guys have to know, why this website is built. Basis of the health information. Where do they get their information? Is it based on research? Is it based on literature? Or is it expert opinion? Or based on or based on personal opinion? how the health information is selected and reviewed, whether the health information is current, focus on equality, does the site have an editorial board, and things that sounds too good to be true often are. Cure for autism, we see this all the time, and none of these are right. You want current and biased information based on research, most of the time, if you can. And look also to the links to the other website. Do they have this website, medical website, and links to Amazon.com, eBay.com, or is it linked to other full website dedicated to health information? And also, how do they interact with the other health information site? Now, having said that, I'm going to go through a few websites that I'm going to point out. I use all the time, and I really think a lot of us should know this website, and I will highlight the most important things in this website. We all guys know the American Academy of Pediatrics. I'm going to point out on this valuable website is what we call the AEP endorsed clinical practice guideline. This is a free guidelines. You can go through them. You can push on the button and you can get all the guidelines you want. For example, since Dr. Muqdadi invited us, we'll talk about constipation in infants and children. And if you push on that, you will end up having this review article. And this is, of course, based on the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition. They just endorse it, and they collect it, and they put it in one place for you. And if you go down, we all love algorithm, you will see this lovely algorithm, and all this information is free. You don't have to pay nothing, you should not be a member, you just can use them for free. That's one of the websites. The other website that we all know is emedicine.com. They merged it with Medscape, and this website is really great. You have to register, but it is a free registration, and it is very easy registration. And I'm going to point out a few of the important pieces of information on this website. First, all of us are looking for CME. I want CME, every one of us needs a CME. If you go to education, and you go to pediatric education and training, and you go down here, you see all the CME activity. You can click into that, and you can review it, and register your name, and they will, through their CME tracker, issue a certificate by the end of the year for you that you have done so-and-so CME on their website that you can use for your license. Again, that's free, you just need a registration. The other things I love about this website also, they have what we call a reference, drugs reference. I went to Trileptin, and you push on the Trileptin, and will give you all this information on the desktop. And I elected to choose warning because I can't capture it in one page. But you can get all this information for free, and even you can do pricing agreement, and you can even do by patient handout. We hardly ever do patient handout. It is very important to do a patient handout, because when the patients suffer from side effects, the first thing they will do, they will throw the medication in the trash, especially in our country. This is my experience, being here for only 1 year, and coming from, of course, Jordan. Another very important thing here is drug-to-drug interaction. Probably Dr. Azam, he used a lot of drugs that have interactions, and this drug-to-drug interaction, you can add them, you can check if there is any interaction between drugs. You can put the name of the drug here, and you can add the drug, and then I elected to use levetiracetam, topiramate, and amphotericin B, and right on the spot they will give you, there is no interaction found. And believe me, sometimes when a patient comes to me, and I don't know what the medication they are on. I don't know their interaction with the seizure medication. And one time we almost lost a patient heart because of Trileptin inducing the immunosuppressant. This, you can just check it out and make sure everything is fine. Not every patient will need that. You probably can have a lot of patients who are like ABC, but some of the patients who are complex, you can use this interaction checker, and it's for free. Now, the other website, I think everybody should know this website. And I got to know this website probably 3 or 4 years ago. This is genetest.org. You really have to know this website. Whether if you are a hematology, hepatology, neurology, that is, or pediatric physician. Very important. Why this website is very important? You can search gene review here, and you can put the name. I put FHLH, familial hemophagocytic lymphohistiocytosis. Did I say it right? Okay. And you push go, and this website will give you a review about free review about this disease. The most up-to-date information, free. That is lovely. It also will give you the resources, all the resources on the internet regarding this disease. And what is even more lovely, if you want to do testing, you can push a testing, and they will give you all the labs in the world that will do testing for this disease. And on top of that, if you push in any one of these labs, they will give you the information how to contact this lab, what is the email for the person to contact this lab, and you can, of course, contact it through lab or through phone. It will be much cheaper to do it through email or through phone. That is for every single disease that is related to gene disorder. This website, I use it all the time. Everybody uses it all the time. Other feature which I love about this website, you can see what is new in gene review. It is a moving target. Gene and genetic disorder moving target. If you just glance through this every 2 months, one time, you will know anything related to your disease which is new. For example, spastic paraplegia type 1. You can just push on that. Dr. Azam, beta thalassemia. You can push on that, and you can see what is new, what is updated, and even if you go down here, you can see what is revised reviews. Okay? So that website worth it is weight gold. Now the other website, that's the website we talked about, is georeview.com. The other website that I think it is really very important is orphanet.com. And this website, what is good about it is about all rare disease. You don't have to open your computer to look for what is the treatment of constipation if you are a GI tract specialist, or what is the treatment for absence seizure if you are a child nurse, or what's the treatment for gastroenteritis. You most of the time you will open this website when you need real information on your health. What is lovely about this website, if you look here, it's called Assistant to Diagnosis Tool. If you push in that, okay, you can put, I have a patient who has macrocephaly, coffee-olate spots, seizure, epilepsy, and you can change the option here from optional to mandatory, and you can push search. We'll give you all the diseases that might come with this presentation. And all what you need, guys, just push on neurofibromatosis type 1, and we'll give you all the information about neurofibromatosis type 1. Absolutely free. Here, this is the rare disease. You search by sign, classification, genes, encyclopedia for patient, but search by sign. I love this website because there's another website called simconsult.com. It's a lot more complicated than that. That's very simple and very easy. So we could use this a lot. Now, other things on this website, if you go to the expert centers, I have a patient with Stargardt disease. Does anybody know what's Stargardt disease? Stargardt? Yeah? Stargardt. And I don't know, but it's a very, very simple. It's one of the macular degeneration. You have a patient, you put here expert opinion or expert center. I want to know which center in the world deal with Stargardt disease. I put the name of the disease here and they push OK. And all what you see, they will give you all the diseases related to that disease. Okay? Which also help you, to compare your diagnosis. And for example, I put neurofibromatosis, you push neurofibromatosis, and we'll give you a list. In UK, if you go up here, I put the United Kingdom. The only Arabic country is Lebanon. Even Jordan is not on there. But if you push there, they will give you all the expert center in England or in the United Kingdom that deal with neurofibromatosis. And if you push on that, on either one of these, they will tell you what is their contact information, how to contact them, what is their website, what is their email, everything you want. That is also, I find it very lovely. Now, of course, everybody is familiar with CDC. I'm going to point two things about the CDC. Center for Disease Control and Prevention. Very important if you want to do a presentation. I love this website when I do my presentation. Diseases and condition, and injury, violence, and safety. If you go down, you will find every single disease known to man, classified based on their alphabetical order. So I choose autism here. You can double check on autism, and they will give you the basics about autism, screening and diagnosis, treatment, data statistics, article, research, and practical free materials. If you push in the free material, before the free material, if you go, for example, to data and statistics, you will find they tell you the latest statistics about autism. And down below, I was not able to get the whole page. Down below, you will find a lot of diagrams and algorithms. You can just copy paste and put your presentation. And if you go even for free materials, you will find a lot of free material you can use that you can view or print. And if you go down, you can find another language. And here is the Arabic language. And you can just push on that. And you can get an Arabic handout for the family, for the developmental milestone, of course for free. The last time I had to do that, I gave it to the translator, and it took me almost 2 months or 3 months, probably 2 or 3 visits until they translated 2 or 3 pages for me. You don't have to do that. This is all there, but you know where to find this information. Now, another thing I want to point out on this is safety, and I see a disaster from drowning. So if you go injury, violence, and safety topics, and you push on drowning, they will tell you all the tips about drownings, and you can, of course, you can download the free materials for the family, and you can do the same thing by bring it down and give it to the family. And there's a lot more information to that, but these two functions of this website, I just love them. Now, why do we need to know the internet resources? In order to do the best for our family and for our patient, right? If you see this website, and you see how much family, when they are very desperate, they will do anything they can to save their kids. This website, they will tell you there are 2 things you need to know. Autism is treatable, which is nonsense. Inflammation and immune response at the core of the autism is the core of the autism problem. And what they do, they milk the patient out. They give them, they do a lot of labs, and they get commission on that. They give them a lot of information and chelation, which is most of the time is not helpful. That is why you need to know the good internet resources to stay calm, right? Now, anybody knows what is that? Along the line of the XX clinic? Hamza. This is not about I hear it. Was it that? Colosseum. Do you know what did they use the Colosseum for? For radiators? Yes. Great. This is used to be covered, and everybody will be sitting around here watching a lion against man, live, or a man against man fight until death. And after they die, one killed the other. What they do, they drag them out while they are bleeding through these doors. Right before they go out through these doors, people will be lining up here and collecting blood. Does anybody know why did they collect the blood? No. It used to be the drug of choice for seizures. That is why they used to collect the blood. So this used to be the drug of choice for seizure, or what they call even sickness. So it's along the line of the XX clinic. There's a lot of people from the ancient time that they do nonsense. So that's why you need to know all the internet resources and the good resources.
Did they check it for interaction?
Okay, and the other lovely website I like is raredisease.org, and about this one you can go to Rare Disease Information Database. By the way, all these are trusted websites. You can go to Google Google and put a piece of information, and you get tons of information, but you don't know if it's trusted or not. You don't know if it is based on Dr. Muqdad bias or Dr. Muhammad bias, and I know you are not biased, but is it made for Dr. Alsayouf clinic so he can pull up a lot more patients? We don't know that. So these are trusted websites. You can go there and get the information you want. Now we go to the rare disease database here, and you push on that here, and you go down. You end up, of course, with search. I put slicing. This is the first time I heard of it. It's called slicing. It's one of the mucopolysaccharidosis that we never ever see. You push here, search, and you end up having slice syndrome, mucopolysaccharidosis, and fucosidosis. By the way, you have to do free registration. Take you 2 minutes. And you push down, you get you the abstract for free. If you are really don't want to even register, they will get you general information. If you want to view a full report, you can push on that, and what is lovely, they give you the standard up-to-date therapy, how to diagnose, what is the treatment. They give you the investigational therapy, okay? And even they point out the clinicalgov.com or private Center for Research, which is centerwatch.com. And all of these, you can get them for free. So that's another website I love to use. Now, I hope everyone is aware of clinicaltrials.com. I have a patient all the time. They ask me about autism. Is autism treatable? Is there any treatment for autism? Can we do stem cell for autism? Tell me about Laminda or Limantine for autism. You can just go here and put search, and you will find all the studies. If you see here, 377 studies found for autism, and you can pick the one you want to answer a question about, up to date, trusted information, and you can tell the patient, and you're not going to be scared if Dr. Wasim told him that it is, this is the last thing. I'm not going to be scared that Wasim is going to second guess my information, because you got what you want from a trusted resource. See it? Now this website really, it's amazing. Does anyone ever did anyone ever hear about this website? Guideline.gov. This is the best website you can ever use. If you go to guidelines here and push on guidelines, every guidelines made about a disease in any country, Africa, Asia, America, or even Mozambique, is on this website. If you go for me, Child Neurology website, I want to go to Child Neurology Society guidelines. Okay, you can just push and see. You see how big is this website? You can push and see, and you go down. This is Child Neurology Society guidelines. That every guideline about neurological disease that Child Neurology Society had ever made. Children Oncology Group, of course, they have their COG website. That this is, Cincinnati Children's Hospital. Every guideline that Cincinnati Children's Hospital use for kids is on this website for free. And you just all what you need. You can just push on the information, and they will tell you the full information and the source for the information. I think this website is really phenomenal. You don't even have to go to the Child Neurology Society or American Academy of Neurology or American Academy of Pediatrics. Just use this website. Now, if you want to learn a website in neurology, please do me a favor, do yourself a favor, do the patient a favor, and learn this website. It is the neuromuscular database on the internet or on the internet. Every pediatrician, every physician, even every nurse, they will be faced with weakness. What is lovely about this website, it is monitored by Washington University of St. Louis, and you can go and look at the disorders by their name. If you think the patient has myopathy, weakness, muscle weakness, or if you think the patient has neuropathy, Or you don't know. What I will do, I go ahead and push the neuropathy here, and you end up having this thing. And for us, or for the general pediatrician, the weakness happened acute, okay? Or is it infantile since he was an infant? Or was it recurrent relapse? I would use acute because this is most of the time what we give it. You're pushing acute weakness. This is what you're going to end up with. You end up with Guillain-Barré syndrome. And if you read this one, or if you know this website, you're going to know more information that I know about Guillain-Barré. And they will tell you, if you're pushing Guillain-Barré syndrome, they will tell you every single thing related to Guillain-Barré syndrome up to date from a very trusted website. They will, this is immune. Then they go tell you about toxic, and you can scan through them. If phosphomide, I don't know, do you guys use in pediatric? Yeah, if phosphomide, you can just, if the patient was taking the phosphomide and you call Dr. Omar, I told you, listen, I can't come, I can't wake up at night, let me see. I had a busy day. You can just look at this website and you can find that the phosphomide might be the cause for that. Infections, all the infection or the infectious disease that cause weakness and also the metabolism. This covers every single acute weakness secondary to neurology. Now, if you think the problem is a muscle disorder or is it related to muscle, the kid has ptosis. I don't know what is the cause of the ptosis. I'm not a child neurologist, I'm not a neurologist, even a child neurologist, I don't know what's going on. You just need to go here, yeah, it's focal, it is muscle weakness, and it is ptosis. You push on that, and you end up with this page. Horner syndrome, Scheringer palsy, Marcus-Gann-Jaw-Winking ptosis. I have seen it one time in my life. Congenital ptosis, levator dehiscence, and you go down all the way to go through almost every single disease that causes ptosis. If you are dealing with episodic muscle weakness, you can also find all the information about episodic muscle weakness. And you can use it as to help you with the diagnosis and also to obtain information about this disease if you, in case you want to educate yourself about Guillain-Barré syndrome. This is more of a main website, I think, for the professionals. And for the family, midliners, that is a phenomenal website, I think. This website will cover you with information about the diseases. You can just need to put neurofibromatosis search. Will give you all the information about neurofibromatosis and all the resources, all the genetic, and where do they get it from. And if you look at the neurofibromatosis, every single thing related to neurofibromatosis, from clinical trials to patient handout, is available on this website. And this is mainly related to the family. So information for the family. So if the family asks you, where's the website that I can use, to read about my disease, that's one of the websites you can just directly do. It has every single disease known to man. And also, if you go down here, as I said, you can print out the handouts, which a lot of the time, we don't do it. Now, if you want to do medication, you can just go to the drug you want in the search, or you can go through, for example, K, and push one of the drugs there, and they will tell you all levetiracetam skip, all the things that the patient need about levetiracetam or Kibra, and they can read about it and educate themselves. And this makes your life, even as a physician, a lot easier, because the family will tell you, oh, my kid is getting crazy. And Dr. Omar, I'm pretty sure you have seen this a lot. Behavioral side effect. If they give them the handout, they will know right away it's from Kibra. We have seen patient has renal stone and Topamax. They have gone through all the investigation related to renal stone, except thinking that Topamax might cause it. You see how much you can save the patient time, and you save yourself a hassle. Another website is the U.S. Food and Drug Administration. A lot of the time, when I use Tisabri, I'm going to private, and they have to, throw Tisabri in all multiple sclerosis, left and right. I need the current information. I know when I was in residency, there was a review and there was ongoing trials, but I did not keep up with that. You can just come here to FDA and put the information, put the Tisabri, and they will tell you every single thing about the Tisabri. Even the safety and the medication guide, when they reviewed its problem and what was the problem related to Tisabri. And they will, for example, if you push on the FDA drug safety communication, this is one of the biggest problems with established risk of a progressive multifocal leukoencephalopathy with the use of natalizumab. Another neurological website that I love is National Institute of Neurological Disorders and Stroke. You know, I tried myself to keep myself away from neurology, but you know, I keep drifting back. But this website is really awesome. You can go down and look through all the diseases, neurological diseases, and just push in the disease, and they will tell you all the information, mainly oriented to the family. And if you push, for example, pneumonitis optica, they will tell you, you know, educational material about pneumonitis optica, and on top of that, they will give you every single thing related to neuromyelitis optica, from the resources to the clinical trial to the support group, which is, I think, it's only, you know, 1 click away from the patient. Now, unfortunately, we don't have much of the Arabic website, so we have some time to go and do translation. This website called At-Tibbi, I find it very helpful for drugs. You can push on the medication here. You put it in English, and they will pull all the information about the Kebra, for example. And if you need this is more of, you know, this is more of, you know, a focused review. If you need a bigger review, you can push on. There's a link down, and they will tell you all the information in Arabic about Kebra. Unfortunately, it is not as good when you talk about diseases as drugs, but I use it for medication, for family. Just print it out and tell the family this is the camera, you can use it, and this is what you expect for a side effect from the camera. We are not really, you know, doing defensive medicine, but you know, a lot of the time, you need to cover also yourself. Now, this is another website in Arabic about, you know, called Al-Wiratha Al-Tibbiyya, and this website you can just search all the genetic disorders that is in Arabic, and you can pull the handout and give it to the family. Now, this website is really phenomenal. It's called ICNA-P. And this is the official website for ICNA, International Child Neurology Association. What is good about this website, you go to e-learning, there's a lot of good stuff, and you push your lecture here, and you get a lot of lectures for free. Child neurology lectures for free, written from big figures. For example, Dr. Naido has just a lecture here. Yeah, here, this is Dr. Naido. She's probably one of the big figure in neuroradiology, findings in inborn error metabolism. You can just push on that, and this is what you're going to end up. You can scroll through the whole lecture and review it for free. I don't have to come to Dr. Muqdad, can you please send me your lecture? You know, and he might even not send it to you. And he will, and Dr. Muqdad will do it. But you know, a lot of people, they will not do it. Because you know, we're not like in America, everybody will just send everybody the lecture. So that's, you can go for free and review all the lectures. Now, what is more even about this website, you can watch video lectures on the website on the same. If you go back here, clinical video, and you push on that, there's recorded video, recorded lecture you can go and watch for free. This is, of course, related to child neurology. Now, neuroradiology website, if you want to know anything about neuroradiology, go to this free website, radiomedia.org, agnr.org, and grad.ushs.edu. This website, it is the top of the line free neuroradiology website. I use them all the time, and they are phenomenal. I use them for my presentation. I got a review, and I got also a review articles from for free. Now, one thing you might think of, I wish I have a website that have all the information on my presentation. Do you agree, Muhammad? It would be lovely because the moment you go out here, if you have a busy day, you might forget about it. I would rather have you send the lecture for a small price, which will be fine. You know what? But we will soon have our child neurology website that has all the information. On top of that, we will at least have 40 video, audio neurology lecture. We recorded the whole conference that we did last week, and it's going to be for free, but you have to register for free. And all this information will be there, and we have at least 80 or 90 free lecture online in child neurology, neurology, and PDF. So once we have it live, it's called acnuae.com, and I'm going to be the website. Now, why do we need to know the internet resource? We go back to the same question. In order, when the patient comes, in order not to look so lost. And I hope you're going to enjoy this Yunus Shalabi, Allah yarhamu. This is the most exciting part. Is it working? So a lot of the time you do want to look in front of the patient, you are lost when they ask you about it. What do you think about how baric oxygen and autism, which is people are paying 30,000 dirham in Dubai? When people are paying 30,000 dirham to use hyperbaric oxygen, and you know how much does it help the patient, Dr. Umar? Zero. It might harm him. He might become autistic and mentally retarded, which you don't want to do that, okay? And now, you don't want to look like Michelle when they ask you a question.
فين منصور ابنه؟ انت منصور؟ ايوه لازم حد مصور البيت طبعا، ايه حكايه منصور؟ انا منصور ابنه، انا منصور البتاع، منصور الجواب ولا منصور منصور هو قال لك ايه انت ولا عمل لك ايه هو؟ هو مش قال منصور ابني؟ مش هو كان بيقول منصور ايه ولا بيقول منصور ولا عمل ايه ولا قال لك حاجه ولا عمل لك ولا انت قلت له ايه اسمك ايه انت ولا عملت ايه؟ انت سيدي اسمك كمان؟
And with this one, I really want to, tell you guys about, and we are ever growing child neurology department in Mafraq Hospital.